Engagement is such an important component of healthcare. At the end of the day, the patient should be the center of the healthcare ecosystem. And the barriers that exist oftentimes in the populations we serve, which are the vulnerable populations, exist outside of the four walls of a doctor's office. So they include things like the social determinant barriers. They include education barriers. They include things like food insecurity, housing insecurity. And if you can't solve for those barriers first, then the health plan member, the patient that you're talking to doesn't feel the need to connect with you about going to have a breast cancer screening or going for some other screening or going to an annual wellness visit because they're struggling to put food on the table for their family that night. So we have to take a whole person approach to member engagement. And by doing that, what we're able to do is establish a trusted relationship with that member. And once we've established that trusted relationship, then we can encourage a member to take the actions we know they need to take in order to get on the proper health plan. Human connection versus fully automated outreach is a very interesting topic, particularly with the emergence of AI and AI agents. At the end of the day, again, our company focuses on the vulnerable populations. Those populations are subject to so many barriers, but the population is also overall distrustful of the current healthcare system, distrustful of the government. And so when a fully automated system reaches out to them to tell them perhaps that it's time for a doctor's appointment or it's time for a breast cancer screening, and they know it's just a recorded word, it doesn't achieve the threshold of a trusted relationship. And by having an individual engage in a conversation with those members, with those patients, we're able to establish that trusted relationship. Quite often, our health plan clients ask us for our scripts. We don't use scripts. Our care coordinators and care managers to engage in conversations, ask the member how they're doing, and then stop and listen. So we try to encourage our team members to listen and then look to what the members are saying they need and then address those needs and then ultimately get them to where they need to be, which benefits the health plan, benefits the patient. So measurement of meaningful outcomes beyond the typical compliance metrics, the gaps of care, star ratings, HEDIS gaps, those types of things. At the end of the day, what I think everyone really wants is for members that have historically been disengaged in their own healthcare and in the healthcare system to get re-engaged and therefore get on a path to better health. Oftentimes, it's not because they don't want to. My simple premise in founding this company was that no one, regardless of their socioeconomic status in life, chooses to be chronically ill. If you accept that as a premise, I don't know anyone out there that would not accept that as a premise. You have to ask yourself why members of these vulnerable populations are so much more chronically ill. So we have to overcome those barriers that exist and help people get to a better health path. By doing that, we will achieve the metrics that the health plan needs to improve their star ratings. We will achieve the metrics they need to reduce inpatient and ER utilization metrics and save them money. We will achieve getting the members in for annual wellness visits so that they can get the appropriate HCC codes based on the conditions and drive the appropriate risk adjustment the right way. I think the thing I'd like to share most is the emergence of artificial intelligence. Obviously, it's a major topic of conversation, and on so many levels, it's fascinating to me. From the inception of the dot-com era and as technology has emerged, technology has historically served to drive human efficiency. I think AI will drive human efficiency to the nth degree, which is great, okay? It doesn't mean that we will lose the need to have a human touch in member relationships, particularly as it relates to the vulnerable members. And when I say this, it's important to understand that this segment of the healthcare population drives an incredible amount of expense in the healthcare system. And so to the extent that we can leverage AI and technology to make humans more efficient, more effective, then we can engage people better, reduce cost, and everyone wins and have better health outcomes.